Hi, everyone. Welcome to part 2 of Brain Awareness Week with the Society for Black Neuropsychology. We'll be continuing presentations with our theme of lifestyle habits for a healthy brain. I'm Day O'Shea. I'm the chair of the SBN Education Committee, and I'm so happy to have all of you here with us again today. I'm also joined by Jessica Pereira, who'll be able to speak more. She's one of our SBN Education Committee members. Some of you joining us may be familiar with SBN. Others may have come across our promotion of this event and haven't been involved. So please contact us, get on the email list, join our Twitter, X social media accounts, follow and subscribe to the YouTube for more great information about brain health, neuropsychology, educating, studying more information about this great field, and learning about how we can apply brain science to healthy living. If you haven't seen our previous presentations, they are available as recordings on the YouTube channel. And this one will also be available if you want to reference again later on. All right, I'm going to turn to Jessica now to say a little bit more about how we'll be proceeding through the talk today.
Hi, everyone. Thanks for having us here. In a moment, we're going to bring Ronnise on, and I'm going to be moderating the chat for any questions and comments that you would like to present to her. I'll just be synthesizing that, and then at the end of Ronise's speech, I will be presenting Ronnise your questions and comments. So anything that comes up, just feel free to drop it in the chat function, and I'll present that to her at the end.
Great, thank you. So with that, we have Ronnise Owens, who'll be speaking more about sleep and brain health.
Hi, everyone. It's so good that you all have joined us today for our second talk for our lifestyle habits for Brain Awareness Week. I will be talking all about sleep and brain health on today. So again, my name is Ronnise Owens. I am currently a doctoral candidate at Mercer University College of Health Professions, and I am on internship, and this is my final year, my graduate training. And so I am on internship at Nationwide Children's Hospital in Columbus, Ohio. And so I am the pediatric neuropsychology intern there. And that has been my training trajectory. And then once I graduate in May and finish up internship, I will then begin my postdoctoral fellowship at Emory University Department of Rehabilitation Medicine in Atlanta, Georgia. And so that is my training trajectory. I also have a master's of public health that I got prior to starting my doctoral studies in psychology. And so my goal is really to bridge brain health, pediatric brain health, looking at brain health across the lifespan, and really seeing how, from a neuropsychology perspective, assessment and intervention can kind of really align, and increasing that health promotion and community advocacy and education. And so particularly my interests are rehabilitation, as well as the oncology, hematology interests. So particularly like brain tumors, blood disorders, and sickle cell. So those are my main interests. And I'm really interested, like I mentioned, across the lifespan. And so this talk today will be pretty much across the lifespan as we're talking about sleep. And so an overview of what I will be discussing is first, just what is brain health? and really breaking that down, and then talking about some determinants that impact brain health. Then looking into sleep and really focusing on sleep as this healthy habit for the brain. Then going into a little bit of anatomy, some neuroanatomy of the sleep, and talking about that sleep cycle. Then I'll talk a little bit about sleep and the circadian rhythm. Then I'll go into the social ecological framework of sleep. Also talk a little bit about some racial ethnic disparities that we see in sleep. Talk a little bit about the impact of poor sleep on cognition, and then really go into like, what are some of these healthy sleep habits that we can have? And then at the end, I am going to leave you all with the challenge that you all can take from this presentation and really implement into your daily lives. And so as I begin, I think it's really important for us to all get on the same page and really think about what is brain health. And so according to the World Health Organization, brain health is really defined as the state of brain functioning across, cognitive, sensory, social, emotional, behavioral, motor domains. And this allows a person to realize what their full potential is across the life course, irrespective of the presence or absence of disorders. And so really the idea with brain health is kind of, despite all of these other factors, like how can we really help you live this optimal well-being life? And a part of that is really understanding what the brain functioning is and how we can really optimize that to really improve well-being. And so when we're thinking about just optimizing that brain health, there's a lot of determinants. And so the public health in me always goes to social determinants of health. And so within brain health, there's some determinant factors too. And so these are just some factors, whether they're individual factors, societal factors that can impact brain health for someone. And so looking at this chart, we really can see that there's a lot of different determinants. So you've got different aspects of like your physical health that can impact your brain health. We've got aspects of like your healthy environment. Is the environment healthy that you're in? There are different things that people can be surrounded in that impact their environment. So like the safe use of chemicals within environment, protection from like radiation, living in more of like a healthy and safe workplaces and work environments, having good access to like nice air and water quality. Safety and security is another determinant when we're thinking about brain health. And so thinking about financial security, physical safety, humanitarian crises that someone may experience, and thinking about, natural disasters or any emergencies. All of these things can really impact brain health. And then if we're thinking about learning and social connection, so that education, that lifelong learning process, nurturing care, social networks that someone may have. And then we have access to quality services. And so different things we can think about are like career support, skilled workforce, access to essential medicines, diagnostics, and health products. And so as you can see, there's a lot of different determinants that really can impact one's brain health. And so I have circled here physical health because that's really what I'm going to be focusing on, is aspects of physical health. Primarily for me, it's going to be sleep today, of how that then impacts our brain health and how we can optimize that. And so by addressing these different brain health determinants, we then can see how we optimize that brain structure and function, ultimately with the goal of enhancing one's well-being. And this is across the lifespan. And lifespan being children all the way up to adults. So if we're thinking about kind of the physical determinants of health, this can be broken down into so many different aspects. And so right here is just like a graphic of just 10 different healthy habits that we can have for our brain. So different things like protecting your head, challenging your mind, being smoke-free, controlling your blood pressure, being active and moving, maintaining a healthy weight, managing your diabetes, eating right, staying in school, increasing that like educational level. And so these are all different healthy habits that you can do and really optimize for that brain health. And so specifically out of these 10 different things, I am really going to be focusing on sleep, is how we can have these healthy sleep habits to really optimize our brain health and enhance our well-being. And so when we're thinking about sleep, I think it's really important that we really kind of operationally define what sleep is and how we're going to be discussing sleep for this presentation. And so when I'm thinking about sleep, I really like to think about what is the sleep quality as well as the sleep quantity. And so when we're thinking about sleep quality, it's that sleep, so it can be broken down into 3 different aspects. And so one is that sleep latency. So that's how long is it taking you to fall asleep at night? Another is your sleep awakening. So how often are you awakening throughout the night? So you've fallen asleep, then you tend to wake up. Research has shown that about 3 to 4 awakenings throughout the night are not really good indicators of that good sleep quality. So it's really important to think about how often am I awakening at night? And then something else to keep in mind is when you do awaken, how long does it take you to go back to sleep? Is it just briefly kind of waking up and going back, or is it's so hard for me to fall back asleep? And so those are things to keep in mind when we're thinking about that sleep awakening period. And then sleep efficiency, this really goes more into the lens of sometimes people need like sleep studies. And so this can be determined with a sleep study. And so sleep efficiency is really a ratio of your total sleep time to the time that is spent in bed. And so researchers have found that about 85% and above is a good indicator for sleep efficiency of that good sleep. And so some factors that we can think about that may impact some of these different areas that may maybe move us into maybe some of that poor sleep quality. We can think about things like poor sleep hygiene, maybe some lifestyle choices that just may not be the best and suitable for sleep, but then also some lifestyle choices that we kind of have to make, such as like work obligations or things that we have to do. Maybe you're on a schedule to where you work really late in the evenings or you're very busy. Stress, anxiety, those can all be factors that can impact your sleep quality, as well as if you have a sleep disorder. These can all impact and contribute to having that poor sleep quality. And so then when we go over to the other side of thinking about your sleep quantity, that's really how many hours of sleep that you're sleeping each night. And so, according to the National Sleep Foundation, they have printed out a really great resource that can be found online of some sleep duration recommendations, and it's broken down by age group across that lifespan. And so, as you can see, prior to that young adulthood period, really the earlier, the more time that is recommended for sleep duration. So, if we're looking at this chart, those newborns, it's recommended that they need about 14 to 17 hours of sleep. Then we're getting up, preschool, 10 to 13 hours of sleep that they need, school age, 9 to 11, and then those teens, 8 to 10 hours of sleep. I think this is a really good resource to really kind of have in your toolkit of knowing. It's because oftentimes, I think sometimes people will say like, I only need a few hours of sleep. I can do it. I'm so busy. And, we really want to think about how this is impacting, right, our day-to-day functioning if maybe we're not getting the recommended amount of sleep hours that we need. And so then as we just talked about that duration period. And so then I want to go a little bit into the sleep cycle. So kind of what does this look like? And so over the course of the night, your total sleep is pretty much made up of several rounds of the sleep cycle. So you're going through several rounds of this throughout the night. In a typical night, a person is going through about 4 to 6 sleep cycles. And so it's broken down here in this graphic, and they're in different colors. And so this yellow color N1 really, that's that first stage. And so this lasts about 1 to 7 minutes. And so this is the stage where you're first falling asleep. And so during this time period, brain activities really start to slow down a little bit. And so that's the initial kind of falling asleep. Then as we move into this N2, which is our stage 2, this area right here is still, we're all in this light sleep area. And so in this time period, your body is starting to drop in temperature. The muscles are starting to relax, the breathing is starting to slow down, and your heart rate is also starting to slow down, and that brain activity slows down. So it's really everything's starting to slow down more, and you're entering and you're in that light sleep zone. Then in 3, which is that stage 3, you're going into that deep sleep era. And so this is where those delta waves start being activated. We're starting to see them. It's more of that slow wave sleep activation that we're seeing. This is a really critical period for recovery, that restorative sleep aspect. So your body needs sleep so that it can recover and grow, and it really helps build and bolster that immune system. And so if we're thinking about this, it's really helpful to make sure that we're getting these adequate sleep, right? Because our body's got to go through a lot of different processes throughout sleep. And so this deep sleep area right here, it helps contribute to things like insightful thinking, creativity, and memory as well. And then this 4th stage right here is that REM sleep stage. And so this is where that vivid dreaming starts to happen. And so the brain activity starts picking up in this area, and it's essential for things like cognitive functions like memory, learning, creativity. This is, again, that it's known for that vivid dreaming area. And so as you go through the night, you're repeating these different cycles. But what's interesting is about the sleep cycle is although you're repeating it, the REM sleep actually starts getting longer. And so the duration of all of these different stages may not remain the same, but that vivid dreaming and that deep sleep actually tends to get a little bit longer throughout the sleep cycle. And so then a little bit of anatomy, kind of going to this neuroanatomy piece. This is a snapshot, kind of the brain kind of sliced in half, and we're looking more on the inside of it. And so these are all some really important functions that the brain holds in order to help us with sleep. And so first, this hypothalamus area, which is right around here in this area, that hypothalamus is really essential for, it's a control center that affects like your sleep and your arousal. So it's a really important factor and proponent for sleep. And so then within that hypothalamus area is right here, this SCN. And that's your suprachiasmatic nucleus. And so this area right here is a cluster of a lot of other nerves, and they receive information about light exposure directly from the eyes that then control your behavioral rhythm, also kind of known as that like circadian rhythm. So that SCN area in the brain is really important for controlling that like circadian rhythm. And I'll go a little bit into the circadian rhythm in the next slide. Then you've got this brain stem structure right here. And so this is really important for communicating with the hypothalamus to control transitions between wake and sleep. The brainstem also plays a really special role in REM sleep as well, sending signals to relax those muscles, essential for body posture and limb movement so that we don't act out our dreams during those REM sleep moments. And so that brainstem helps to really relax our muscles and body posture when we're in that REM sleep and that vivid dream aspect of sleep. So then another important part of the brain is our thalamus right here. And so this thalamus is a relay information station. And so it relays senses to the cerebral cortex. The thalamus is also very active during the REM sleep phase, and it helps to send images and sounds and different sensations, and that really helps to like fill out our dreams. And then we've got the pineal gland right here. And that is a really important structure that receives signals from that SCN area over here. That's important for that circadian rhythm. And so that pineal gland, it helps to increase the production of the hormone melatonin. And so we know that melatonin is something that's produced and it helps with that sleep cycle and helps, with producing that, sensation of like wanting to fall asleep. And then we've got our basal forebrain. And so this helps promote sleep and wakefulness. And our midbrain, which then helps to promote that arousal system. And then our amygdala right over here, and that processes emotions and becomes very active during REM sleep. So this anatomy slide is really just to show you how many different parts of the brain are responsible just for sleep. And they all play different vital roles in sleep. So our circadian rhythm and sleep. So the circadian rhythm is your body's internal clock. And so it's this 24-hour cycle. It's your body's internal 24-hour clock that helps to carry out essential functions and processes. And so this can also be known as like your sleep-wake cycle. And so that internal clock is going to be directly influenced by different environmental cues such as light. So that's why it's really important when you're thinking about that sleep-wake cycle of, when it's light, you want to be awake, and when it's dark, that's a sign of like your body is starting to become tired. And so that circadian rhythm can help promote that consistent and restorative process. And so sometimes people may have what we call like a disturbed sleep-wake circadian rhythm cycle, and that can cause problems. It can cause sleep problems such as like just difficulty falling asleep sometimes. They may find that they may wake up more throughout the night, that restless sleep, can't really, fully fall asleep, get a good night's sleep, and just unable to really just sleep throughout the night. Some things that can throw off the circadian rhythm are things like jet lag, work shifts. So if you are someone that maybe like works at night, works that third shift, right? Like some of these things, and if that's like an immediate shift for you, those things can also throw off the circadian rhythm. And then just irregular sleep patterns as well. And so we can think about different things that I've mentioned earlier that can impact your sleep patterns and that can impact poor sleep, such as maybe stress, anxiety, like your mood, and maybe some other factors that are maybe not the healthiest health behaviors, essentially, that can maybe throw off and have some irregular sleep patterns. So then when we're thinking about sleep as a whole, I think it's very important because there's different things that can throw off these irregular sleep patterns. And when we're thinking about sleep, it's not just this individual soul entity of this is good sleep and sleep equals like health and well-being, and this is great. But unfortunately, there are a lot of different aspects that can really impact, and there are disparities that can impact sleep. And so it's really important that we think about sleep from this socio-ecological framework. So we're not an individual in our own silo, but there's a lot of other frameworks and factors that then have an impact on the individual and their health behavior. And so, for example, individually, sleep can be impacted by one's mental health, maybe by their race and ethnicity, their temperament, their biological makeup, maybe any genetic factors that someone may experience, discrimination, immigration, refugee status. So these are just individual things for someone that may impact their sleep. But then also when we're thinking about, if we go out a little bit further to more of these family factors, so like family stress, family structure, are you someone that is in an environment where there's a lot going on in the house, everybody's on different schedules, and so one person's, it's time to go to sleep, but then everybody else is, around the house and doing so many different things? These all things can be just a little bit of stress, and just the structure of the family just may make it a little bit difficult if everybody's on different sleep cycles or different sleep waves and times that they go to sleep. And so these are family factors. Also, kind of beliefs about sleep and health in general can impact one's sleep behaviors. So if we think about if someone is like, I, just go to sleep and I will go to sleep when I need to, and doesn't matter how many hours, like I'll go to sleep. I'm so busy. I have all these different things that I need to get done, right? Like these are their beliefs about sleep, and that can impact their also ability, their sleep behaviors. But then we can also think about family beliefs also, not just individuals' belief, but also their family beliefs about sleep and the importance of sleep and how it impacts them, especially if you think about somebody that has so many responsibilities to get done. Then we think about resources, bed, and bedding, right? I see these wonderful commercials of how you can have the best mattresses and the best sleep, but everybody can't have these wonderful luxurious mattresses that promote amazing sleep if we're thinking about socioeconomic status. And so we can see how all of these different factors impact and really play into these sleep behaviors and these sleep lifestyle habits that someone may have. And then if we think even further, going more into the neighborhood and broader social cultural factors, there's a lot of different factors that can then impact one's ability for healthy sleep. And so some of these things, as you can see on this chart, are like systemic racism, exposure to environmental toxins, neighborhood cohesion and safety. Something particular is residential segregation can also really be attributed to some environmental features that can impact sleep health in many disadvantaged communities. And so you can think about maybe these disadvantaged communities have increased crowding, a lot of noise, maybe a lot of light, air pollution. And so all of these different things can contribute to just having a greater burden of poor sleep health. And then also living in these disadvantaged neighborhoods can also be associated with insomnia symptoms, longer wake after sleep onset as well too. And so these are all some different factors that really can impact one's sleep. And so going a little bit further into racial ethnic disparities within sleep, we know that systemic racism has affected sleep through many different consequences of psychosocial trauma, discrimination, microaggressions, and stereotype threats. And so researchers have found that many of those who have experienced racism and who still experience racism now may have lower quality of sleep because they have a greater racism-related vigilance, which can be associated with difficulty of then falling asleep or just maintaining that sleep because of that vigilance that they're having. And so some studies that I found really kind of addressed these disparities. And so particularly for African Americans, they have disproportionately higher rates of sleep disorders compared to other racial and ethnic groups in the US. And so we know when we're thinking about race in general, race is a social construct with different biological consequences that result from different social and economic and environmental determinants that are differentially experienced across racial ethnic groups due to many different historical and contemporary forms of discrimination practices. And so it's important to think about that in the context of why we may see some of these disparities within communities of color because of these systemic injustices and inequalities that they've experienced. And so in some studies, particularly in a Chicago area sleep study, sleep duration, so that amount of time, that hours that someone is sleeping, was shorter among Black participants in comparison to whites. And so what this study really showed that having that shorter duration of sleep is also associated, that we know, with some adverse medical effects as well too, and just some adverse difficulties when it comes to kind of that cognition aspect of why sleep is so important. And then in a study at Yale, researchers found higher rates of short and long sleep duration in Black participants. So these Black participants, as they were looking across many, many years, they found that within a short duration, there were higher rates, but then also that on the longer end of sleeping much longer than maybe that recommended time frame was a lot longer as well too. And so what researchers found was when they then analyzed this by age, disparities were highest for young and middle-aged Black adults. And so it suggests that there are some many different factors related to work or employment conditions that disproportionately prevent Black individuals from having that adequate sleep. And so also researchers have found that whether it's the short duration or maybe a long sleep duration, they both can be associated with some adverse medical effects. And so in the realm of cognition, how can poor sleep really impact cognitive performance? And so in the short term, what researchers have found is that there's this difficulty of sustaining attention. And so with sustaining attention, being able to really focus and sustain and really focus in and gather and that information and be able to concentrate over an extended period of time is difficult. Also, that processing speed is a lot slower. It can be slower for people that are being impacted by just having poor sleep. And so it may take longer to complete assignments, take longer to do different tasks than normal because just not moving as quickly when you're not having that adequate sleep. Also, working memory tends to be another aspect of cognition that can be impacted. And so this is really the ability to hold information like online. And so being able to hold that information and then use it within a shorter period. And so that tends to be a little bit difficult. Cognitive flexibility, that like ability to switch back and forth, initiate, multitask, that tends to be pretty difficult. And that multi-step problem solving as well too, following multi-step instructions can be difficult. Also, researchers have found that there's an increased tendency of risk-taking and impulsivity for people that may have poor sleep, as well as like dysregulated emotional response, impaired judgment. I tend to think of this sometimes as like if someone just seems like they're cranky, or I know the saying sometimes like, did you wake up on the wrong side of the bed, right? And so these are sayings that I have said to people I know sometimes before. And so we can see how poor sleep, researchers have found there are in the short term different things that we can really see cognitively for people that are having poor sleep hygiene. And so when we're thinking about this short-term impact as well, I think it's important to also consider this feedback loop, particularly this negative feedback loop of sleep and mental health. And so with this feedback loop, if we just start with insomnia or poor sleep, we see that someone is really having challenges with their sleep, then when you wake up in the morning, you're likely not going to feel rested. And so you're having these feelings of fatigue throughout the day. You're really tired, your endurance is probably not the best. And so because of that, you're going to have difficulty focusing throughout the day. And so difficulty focusing, you may start maybe like having some cognitive slips or, making mistakes or different things like that, and just not really as sharp as you normally are because you're having difficulty focusing. And then you start stressing and worrying because maybe you're not performing as well as you know you can, or also it can go back to like, I'm fatigued, right? So all these things kind of just keep impacting. And so you're stressed and you're worried. And so then your mood starts declining. And so then you have this decline in your mental health. And then because your mood isn't as great, then that impacts your sleep. And so it's just this continuing cycle over and over, and this loop. And so essentially what would be great is if somehow you could break this cycle by improving your sleep. And by improving your sleep, being able to have waking up and feeling more rested so that you're not so fatigued and that you're able to focus better. And by focusing better, you're getting everything done that you need to get done. And you feel like you're on top of things. So you're not stressing as much and worrying as much because you're feeling good. And then your mood is probably going to get a little bit better. So it's this cycle of if we can really intervene, then we can really kind of help this cycle and make it a little bit better. And so in the long term, what some researchers have found is that over time, if we're thinking about poor sleep and really more into this like sleep deprivation aspect of poor sleep, it has the ability to really impair that memory consolidation process. So moving that memory into that like long-term memory, it can impact that, as well as it can just increase the risk of Alzheimer's disease. And so specifically what that means is researchers have found in regards to Alzheimer's disease that the key component for Alzheimer's disease, the diagnosis is there's this accumulation of beta amyloid protein. That's like a key component of persons who have Alzheimer's disease. And this beta amyloid proteins are located in the brain. And so what researchers have found with sleep is that people that are sleep deprived or are not having like the best sleep over time, they may see that because what happens is sleep helps to kind of clean out this process. It helps the brain clear out dangerous beta amyloid proteins. And so if you're not having the best sleep over time within the long term, the brain may not be able to do that clean out process. And so then these beta amyloid proteins can accumulate. And so many researchers have found that poor sleep and sleep deprivation across like this long term can increase the risk for Alzheimer's disease. And so along with that, here's some other like comorbid diagnoses or additional diagnoses that may be attributed or kind of that also if someone is having sleep problems, they may be at risk for some of these other diagnoses as well too. And so insufficient sleep has been linked to increased risk for development of type 2 diabetes. Specifically, sleep, optimizing that like sleep duration period and quality, like having good sleep quality is really important for improving blood sugar control. And so for people with type 2 diabetes, that's very, very important. So we can see how if you have insufficient sleep, it may impact blood sugar control. And then people that have poor sleep or just insufficient sleep may be at risk for some different cardiovascular diseases. Specifically, research has found that individuals that have sleep apnea have been found to be at an increased risk for some different cardiovascular diseases, specifically hypertension, stroke, and coronary artery disease. And then short sleep duration also has been seen in different research studies to result in some metabolic changes that could be linked with obesity as well. And then depression. And so we know that one of the symptomatology for depression is, someone having, really insufficient sleep, maybe poor sleep, not sleeping as well, just like a disruption in that sleep pattern. And a lot of sleep disturbance that you might see in someone that is depressed. And so that sleep sufficiency of people with depression should really be monitored because we know the risk for those two. So I've talked a lot about kind of all of the basics of sleep and, how poor sleep can be, harmful and the importance of why we need to really optimize our brain health. And so now, well, how do we do it? What are some practical kind of tools and things that you can start doing maybe at home and sharing with other people about how we can really optimize our sleep and have better sleep practices? And so here's some healthy like sleep habits that you can think of. And so having a consistent bedtime routine that's early enough for you to get at least the recommended sleep duration. And so when we're thinking about that bedtime routine, I think it's important to think about, okay, I'm a very visual person. And so like looking at my calendar, like what do I need to get done throughout the day? What time do I need to go to bed in order to then get enough sleep? And what time do I need to get up? Right. And so really figuring out like what is that bedtime routine going to be? Because sometimes, especially those of us who are super, super busy, we can keep working and going and never stop. And then eventually we fall asleep. And so we really want us to get on a better, like consistent bedtime routine. Also making sure that the bedroom is used for the bed. And so really prioritizing sleep. It's so easy to do so many other things in the bedroom, like being on your electronics, watching TV, kids doing homework. There's so many different things that we can do, but really if we can make that association is like for the the bedroom is, to sleep. And so making sure that the bedroom is quiet, it's dark, relaxing, and very comfortable temperature, that can really help. And then avoiding to use those electronic devices in bed. Also avoiding large meals and caffeine and alcohol before bedtime, reducing that fluid intake before bedtime so that you're not having to wake up to go to the restroom while you're in bed. So kind of reducing those things prior to bedtime. Exercising during the day and maintaining a healthy diet throughout the day. So exercise doesn't have to be anything super strenuous. It can just be some sort of really type of mild exercise. Maybe you're like going walking, and I know we're going to go into physical activity and brain health and on a later this week, but all of these different lifestyle habits kind of come together. And avoiding naps throughout the day. That's also something, because we want to think about that sleep cycle. I know, especially with this time change that just happened, some of us may be having to take naps throughout the day to get ourselves back on the schedule. Try to really shorten, if you have to take a nap, try to shorten it, because you don't want to be having like 2-3 hour naps and then you're up during the night. So really trying to shorten your naps or avoid them altogether so that you can save that time for bedtime. And then for our kids, it's really important to help them understand the importance of optimizing healthy sleep practices, because sleep is so important for brain development for our kids, especially during those early developmental years for them. And so sleep really plays a really big role in like healthy cognitive and psychosocial development in early life. There's benefits such as like learning and memory, emotional regulation, attention, and general just cognitive development. And so it's really, really important for our kids to get that good sleep. And so this figure right here really shows different tips for kids depending on kind of their age. And so for those babies, I know it's easy to want to pick them up and soothe them when you're trying to get them to sleep on their own. But really, you really want to work towards soothing your baby without picking them up, so that your baby is at a point to where he or she really is able to understand that I'm in the crib and I'm in this is my bed, and learning that practice of falling asleep on their own. And once the baby is nice and soothed, leaving the room quietly when they're settled. For our toddlers, we really want to help them get excited about bedtime routine. So rather than it being like a consequence or like not, oh, it's not fun to go to bed. I know kids just want to stay up probably as late as possible, but really doing things to help them for really make bedtime fun. So if that's picking out their pajamas, they, get to do, they're in charge of their night routine. They know what's next, all these different things. If it's reading a book, maybe an hour before bedtime, really getting them into that like wind down period can really be helpful for our toddlers. And then for our adolescents and our teens, they've got a lot of homework. They got a lot of different things. They got the video games, the phones, all these different things, electronic devices that they want to do in their bed. But we really want them to do this outside of the bed so that they can associate that the bed is just for sleep. I know our teens probably are texting and on the phone all night long. And so rather than it being like a punishment towards them, but really helping our teams really understand the importance of healthy sleep behaviors so that they can carry that on as they get older. And so really helping them understand the importance of why it's really not great to be on their devices and how they can, be restful and feeling really bright and awake in the morning. Okay. So I went through a lot of different tips. And so the challenge that I have for you all is that I want you to incorporate one healthy sleep habit. My sleep hygiene is not the best. So I've got some sleep habits that I want to incorporate. And I'm sure there's some others that have got some sleep habits that they'd like to, maybe pick up and try to incorporate. But I want to challenge you to incorporate one additional healthy sleep habit to your routine and then track those changes that you notice throughout the day. As neuropsychology people, we are all about data, data, data. And so really seeing that progress and really tracking and seeing those changes that you notice. Are you noticing by doing, maybe you're having a set bedtime routine, you're getting that like 7 to 9 hours of sleep. Now you're realizing I feel a lot sharper. Maybe I'm not as snappy at people anymore. Or maybe, I feel well rested, really seeing how these different things and different habits can really help make changes and really optimize your brain health and ultimately just your well-being. And so I want to challenge you all to just take one habit that you can incorporate in your day and share it with someone else. All right, and so these are lists of some of my references. And so thank you for having me. It's been a pleasure being able to present to you all. And so now I will take some questions.
Thanks so much, Ronnise, for all of that information. That was so insightful. I'm just going to present some questions to you, just some things that kind of came up while you were talking. So you had mentioned a lot in the beginning of the talk about social determinants of brain health, which I thought was really great. And you outlined a lot of different moving pieces. And so, this is a neuropsychology organization. So I was wondering if you can talk a little bit more about how how neuropsychologists can advocate and what can we do more to address different aspects of brain health related to sleep at those different levels. Can you speak a little more to that and what we can do in our role?
Yeah. Thank you so much for that question. I think it really can start on so many different levels. I think even the individual level, as neuropsychologists, we can really work towards when you have that patient that comes into your office and you see them for an evaluation, really getting to know that patient for who they are and understanding and getting a glimpse of their background. My favorite part of an assessment is recommendations. That's my favorite part because I get to do the testing and put everything together and conceptualize. But then also it's like, now what? And so I like to phrase it to my families of like, now we know. And so now we'll figure out how we can help you navigate the world. Like now we can help you do that. And so in order to help them kind of navigate the world, I got to know what the world is that you live in. And so being able to kind of ask those questions and really getting to know and asking about the environment and like, if I'm making these recommendations for you, are you even able to do them? Right? Like, I think even with sleep, I didn't go into different, cognitive behavioral therapy for, sleep or insomnia or different things like that. Because oftentimes, right, there's wait lists and there's different things. And, what are some things that we can kind of do now in the meantime as we are, waiting on these other interventions for you to be a part of that can really enhance. And so thinking about, okay, what does sleep look like for you now? Like I like to kind of talk to, especially like working with kids, like, what does that look like? When do you go to sleep? Do you actually go to sleep at that time? What are you doing in your room? Right? Like, is there noise outside? Like, what are your other friends doing? And like that helps me kind of get a glimpse of like the neighborhood and the environment. And so I think being open and having that discussion with your families helps get a sense of kind of where they're coming from and how we can adjust things, especially when we're thinking about some of these injustices and systemic inequalities that people are experiencing. I never want to harm a family by recommending something that they can't have, that they won't have access to. So really being mindful of that. And then kind of we're thinking about on different other levels outside from the individual, getting out in the community. I think there's so many wonderful like organizations that are looking for neuropsychologists who have this expertise to really be able to talk and address these different disparities that might be going on and the importance of brain health and these different lifestyle factors. I think by doing that, we help increase health literacy, which we know that in some communities of color is a little bit lower than maybe other communities. And so really getting out and being advocates and not staying in our silos in our offices, but really being out in the community and really working with other community partners and getting this information out like what we're doing tonight.
Yeah, absolutely. And I really like that piece, like how you ended with kind of like, neuropsychologists getting out of the office, because like there is this very traditional, very Western modern of healthcare where people come to us, and like that's fine and dandy, but like, you know, for instance, where I live now is really rural, and so like this piece of going out into communities and meeting people where they are, I think is definitely something that neuropsychology needs to be talking more about, and something that I think we'll be seeing more in the future. But yeah, tonight obviously is a great example of that, especially with the gift of the internet, being able to reach a lot of different people and having that being saved and have it be something that people can see moving forward. You had mentioned towards the end some stuff about parenting a little bit, and like, you know, sleep across different stages. What would you say to the people with kids, the people who are getting up for nighttime breastfeeding and diaper changes and mommy, I want to come sleep in the bed with you and daddy, or like, what would you say to those people who, you know, just are developmentally at maybe a different stage than maybe others who don't have kids that young or not at all?
Yeah, I think that's a really good question. I think the really important thing about sleep when you have these little ones that are, of course, going to get up throughout the night and say, you know, Mom, I don't want to sleep. Do I have monsters under my bed? Or, you know, all these different things that, you know, can I please sleep with you? Is, you know, that gradual fade out. So of course it's not going to happen immediately of, you know, I don't think we want to be like, no, you can't come in here, right? Like you have this nurturing, you know, presence of like, I want to nurture and I want to, you know, be there and be present and I want to take care of you. And then during the day, having those conversations of, you know, okay, we really need to start working on bedtime routine. And so what that means is, and then having this gradual kind of progression of pulling back. And so gradually that might mean, you know, when the child gets up and comes to you, you know, you immediately console them and then they immediately go back to their room. Providing them reassurance that they're safe, that they're taken care of. I will see you in the morning. And so the kind of that gradual aspect of it, you know, waking up and, you know, having to breastfeed throughout the night, doing that, and then putting the child right back down. So doing the things that we want to do, that we need to do for our kids, but then also immediately when that task is completed, being able to put the child back. So that they associate that this is my space, this is my bedroom, and that can help kind of increase kind of that sleep hygiene for these little kids.
Right. And I think also this aspect of like sleep hygiene, I mean, it is in a sense a very privileged thing to have. You know, I think about families, you know, on the one hand, you know, I feel like the way we sleep in this country is also like a cultural thing, you know, where in other countries and other cultures, like co-sleeping is a very like common thing, just a very common piece of culture. And then, you know, if we talk about this intersection of like poverty, for instance, like not everybody can afford to give their kids their own room. So you might have a 10-year-old in the same room as a toddler who's getting up every 2 hours because, you know, they just want attention. They want to be consoled. So like the 10-year-old who maybe slept fine on his own in the room, like now is being disturbed as often as you are. So it's like also looking at all these different layers, I feel like.
There's so many layers. And I think you bring up a good point too of like these cultural factors that really impact sleep and like sleep behaviors and how every home is not the same. And like you mentioned earlier, sleep practices are a privilege. And when we look at it from like all these like systemic angles, like it really is. And so even if it's not being able to put the kid back in their own room, because every kid doesn't have that privilege, but choosing some sort of sleep hygiene practice, you know, whether it's everyone is, you know, whatever time they go to bed, you are avoiding, you know, all the sugar, all the caffeine, all the, you know, maybe that's the sleep practice for that family. And maybe it's not being able to, you know, be in this bedroom by yourself. And, you know, some cultures as well, like you mentioned, co-sleeping is also really vital for them. And so figuring out how you can, I think that the main aspect is improving sleep quality. What does that look like? And how can your quality of sleep be better so that you have optimal brain health? And if it is co-sleeping for some, because culturally that's what's needed, then hey, but how can we make sure that your sleep quality is the best and the optimal that it can be?
Yeah. And I think like also like in gathering information from the interview, like, you know, what's culturally normative for you and what's not. So we can take that in consideration when we're making these recommendations. A little bit about where I train right now. Like I am in very rural America right now. The neuropsychologist that I worked with previously he's the only guy between Indianapolis and Chicago. It takes 3 hours to drive there, right?
Mhm.
And so it's a very rural area, very blue collar area, and there's a lot of factory workers. It's not uncommon to see people who will work overnights, right? Which is a very common thing in factory life. Just last year, I did neuropsych testing on a woman who did a 10-hour shift at a factory, and she ended her shift an hour before. So I had to take sleep into the quality of her results, like how good and how clean is this data I'm getting, right? And so you talked a little bit about overnight sleeping, right? And so I guess I'm wondering a little bit more about how the circadian rhythm is affected on the weekend, right? So assuming that, you have these 5 days consistent work weeks, and then what happens on those 2 days when like you're up and about like everybody else and that back and forth shift, because the way we structure our world is for 9 to 5 jobs, right? So can you speak a little bit more about that, about weekends with overnight workers?
Yeah, I think that's such a good point that you mentioned about like our sleep wake cycle and the circadian rhythm can really be thrown off by those work shifts. And so your circadian rhythm is kind of, I guess, kind of alternating throughout. And so during the week, it's, your sleep wake cycle is one way. And then on the weekend, it's different. I can imagine that it probably would be a challenge as someone is getting like starting out. It would be interesting to see like what that is on the weekend. Like, does your body eventually get used to this? And I believe that's the thing when it comes to like this internal clock of like what your body is getting used to. And so it would be interesting to really see, what that looks like for someone on the weekend. I know personally, I've had some friends who work night shift for nursing. And then on the weekends, it's like, don't contact me until I need to sleep during the day. I'm still on that cycle, right?
Yeah.
So I imagine that it is different for everyone.
Right.
But also I think too, if you're thinking about a family, right? Like if you're someone who has a family, then on the weekends, maybe that's your time that you spend with your family. And so even though you're so tired and exhausted because your body is used to sleeping during the day, you're like forcing yourself to stay up, right? And you're forcing yourself to kind of do these things so that you can stay, on top of it and different things like that. I'm a big proponent of mindfulness and different activities that you can really do to really center yourself and soothe yourself, because we know that mental health has a very vital component when it comes to sleep and that whole process. And so if you are someone that is working nights during the week and then on the weekends you have all these responsibilities that you have to get done during the day, I'm definitely a big proponent on what can you do to really center yourself. And what can you really do to help kind of de-stress yourself and center yourself in that moment when you have all these responsibilities that now you have to do during the day when maybe you're used to sleeping during the day.
Right. So I'm just keeping an eye on our time here. Do you have any like last closing remarks or any words for people in the audience joining us today?
Yeah, so I am super grateful for you all being able to join us today and listen to this talk all about sleep and brain health. I think the main thing takeaway from this is that everybody's sleep practices are different, and they really are really impacted by different systemic issues and different like cultural practices and factors. And so I think it's just really important, even for those neuropsychologists that are out there that are watching, when we are looking at these lifestyle habits, of really being able to understand our patients and their families and where their background is coming from. And as we're making recommendations and helping them have these healthy lifestyles, that we're being really cognizant of the cultural factors that can be impacted and influence sleep. And then being able to recommend some healthy practices. If anybody's able to take one healthy lifestyle habit, then that's great. Sleep is hygiene, and the influence that sleep, it's not going to change overnight. It takes a while to really get like in this routine, this groove of it. But if you can take one sleep habit, then that's great. And so build that consistency on one of those one sleep habits.
All right. Thank you so much.
Thank you.
Great. Thank you, Ronnise Owens and Jessica Pereira. Great thought-provoking commentary and questions to round out the presentation. We did have just one last comment that came in right at the end here. And so I think a great way to end would be, Ronnise, if you have any recommendations for additional resources for people to follow up on if they're looking to explore how to change their habits or understand how their particular health issues could be affecting their sleep or affected by their sleep.
Yeah, definitely.
Resource for people to find more information to complement what you've shared with us today.
Yes, so a really great resource is the Sleep Foundation. So sleepfoundation.org is a really, really great resource, and they have so many different resources for sleep, and really breaks it down, talks about the sleep cycle, as well as so many different healthy lifestyle habits that you can really try to incorporate in your day-to-day. So check out that website.
Great, thank you so much. So that ends our presentation for today. We'll continue with part 3, so stay tuned for more in our series on lifestyle habits to benefit brain health. Coming up tomorrow, we have Dr. Erica Pugh, who'll be speaking about the community, social supports, and how that is also related to health and brain health. Thanks, everyone. Have a good evening.
Thank you.